Hi, everyone. Today we are going to be going through the nonfiction companion text for Annabelle Lee by Edgar Allan Poe from Psychology Today called About Complicated Bereavement Disorder When Grief Worsens Over Time Instead of Getting Better by Deborah Koshaba, who is a doctor in psychology from 2013. Grieving the loss of a loved one tears open our hearts, our lives, and seems to make time stand still as we search for ways to make sense of the loss and what it means to our whole lives. We cry, eat more or less, can't sleep, long for our loved ones, and wonder how we will ever be able to live without them. This is all normal in simple grief. We may even seek counseling to cope with our pain and loss, although simple grief is not a mental disorder. In time, with or without the help of a counselor, the painful and debilitating acute symptoms of grief largely resolve and we get on with our lives. However, for some people, acute grief can gain a foothold and become a chronic, debilitating mental health condition that worsens over time rather than gets better. This is called complicated grief. Pre existing mental health conditions, multiple stressors, emotional dependency, or substance abuse issues complicate the grieving process and increase the likelihood of a complicated bereavement disorder that may necessitate professional treatment. Complicated grief and risk symptoms. Approximately 10 to 20% of bereaved persons have severe enough unremitting reactions to loss that result in complicated grieving processes that may require treatment that include prescription medication or counseling. A history of clinical depression and anxiety, emotional dependent relationship on the deceased, and alcohol and drug addiction are often in the background of people who have complicated grief. During the first few months after a loss, many signs and symptoms of simple grief are the same as those of complicated grief, although for the latter, they linger and worsen. Complicated grief is a chronic, heightened state of mourning. Its symptoms can include extreme focus on the loss and the reminders of loved ones, intense longing or pining for the deceased, problems accepting death, numbness or detachment, preoccupation with your sorrow, bitterness about your loss, an inability to enjoy life, depression or deep sadness, trouble carrying out normal routines, withdrawing from social activities, feeling that life holds no meaning or purpose, irritability or agitation, and lack of trust in others. Inside the grieving brain. The grieving process is unpredictable. Mourners' movement between different stages of grief, much like a pinball machine. They bounce back and forth from shock to depression and back to shock again until they are able to resolve their emotions and integrate the meaning of the loss into their lives. This doesn't mean they will ever forget their deceased loved ones. They are a part of their memories, histories, and life meaning. And even though they dearly miss them, they do not let their memories mentally undermine them. They know that there are other people who need their care, attention, and love and come to accept that their loved one has died. They have found a loving space within themselves for their memories of the deceased that do not let the loss take over their whole lives. In contrast, complicated grievers intermittently bounce back and forth through the stages of grief without resolution. Research findings show that their brains process grief differently from those who are able to resolve the loss of a loved one. The difference seems to be in the style of yearning for their lost loved ones and a hopelessness for the future that prevents them from sufficiently working through the grieving process. Complicated grievers remember the past and imagine the future through a distressed yearning for the deceased, hopelessness about the future, waves of painful emotion, and preoccupation with memories of the deceased. This intense preoccupation makes it difficult for them to recall past and future events that do not include the deceased loved one. It is like all other memories that do not include the deceased are erased from their minds. They only focus on the significant past life events in which the deceased was alive, for example, birthdays, anniversaries, and their deaths. And reflections on the future solely center on what life would have been like if the deceased loved one was still with them. It's normal to yearn for the loss of a loved one. For time, we may look for the deceased in a crowd, momentarily reach for the phone to call them, expect them to come home, and surround ourselves with their pictures and belongings. But these yearning reactions dissipate as mourners work through their feelings about the loss and integrate the loss into their lives. But complicated grievers keep that yearning process alive through their habits. They may create shrines of the deceased, constantly look at their pictures, or talk about them constantly. What's significant here is that complicated grievers do not permit space in their lives for anything but the memories of a lost loved one. Looking on, one might think they are addicted to the memories of the deceased. In fact, addiction may seem to play a role in complicated grief. Researcher O'Connor and colleagues searching for the neurological basis of grieving found that the intense yearning of complicated grievers brings them as much pleasure and reward as it does pain. In both simple and complicated grief, the center of the brain responsible for emotions and memories, your limbic system, is activated. But additionally, the MRI scans of complicated grievers show activation in the brain centers responsible for pleasure, reward, and addiction. Researchers concluded that the pleasure one gets from keeping the loved one alive reinforces the habits that prevent them from resolving the grief. Actually, pleasure derived from the grieving process might explain why people suffering complex grief are unable to get better over time.